We are joined now by Mayor Cynthia Block. Good morning, Mayor.
Good morning, Stephanie.
Yesterday, the province announced it was stepping up its efforts, as we heard, to address the overdose crisis in our city. But what exactly does it mean?
Well, it means it's a coordinated effort and that we have an incident command that is focusing specifically on how do we close the gaps and make sure that we get beyond this specific part of obviously a larger crisis in our city. And we've been working cooperatively with our own emergency measures organization and with fire and police and with the Saskatoon Health Region and EMS. I mean, a whole host of folks that are rolling up their sleeves to try to make sure that we can get to the other side of this. As you know, we've had community organizations that have had to shut down, and that's just a cascading effect. It makes it even harder on the frontline workers, and I just want to give a shout out to everyone who is working overtime to try to get us through this.
What supports is the province offering?
Right now, it's mostly coordination, but also just yesterday, they announced that they are providing 4 more fire paramedics, or at least the opportunity for our fire department to get those folks in place as quickly as possible. I mean, the folks on the front line are exhausted, and that is, I think, contributing to some of the closures that we've seen, and that's just putting more pressure on the overall system, and it backs up all the way to the ERs, and that doesn't just mean folks that are there because of an overdose or connected to an overdose. It means that the whole system is stretched for all of us that need emergency services in our city. So I guess I'm grateful that we have an opportunity to work with the province at this level to hopefully, get all of the right resources in place and also the data to better understand what we're dealing with.
So 4 more paramedics. What other physical supports is the province offering? Are we going to see, more officers on the streets, more naloxone kits, any other physical supports?
All requests for additional naloxone kits have been answered by the province and very quickly. When this began in earnest a few weeks ago, the Ministry of Mental Health and Addictions was forthcoming within less than 24 hours to make sure that there was access and enough supply for what was needed in terms of what we were seeing on the streets.
So that's kind of the province's part in all of this right now, but what is the city doing?
Well, the city has been, on its own incident command for many weeks now, and firefighters and police are working overtime to keep up with the call volumes and to try to make sure that we can save lives and hopefully start to see a decrease in the overall incidence of overdose. I know that was mentioned yesterday, that the numbers are starting to subside, but we're not sure what that means. Is that just, I don't think we can afford to relax. I think that we have to keep up the effort as earnestly as possible to make sure. I always appreciated Chief McBride's comments when he would say, we've made a lot of arrests, and so we feel that the tap into the sink has been turned off, or we're hoping that it has, but the sink is still full of water. And I'm hoping that what we're seeing is the water starting to go down.
For this round, but there's not to say there won't be another incident like what we're seeing right now. So I guess what physical supports is the city providing then when it comes to dealing with this crisis? Because we heard yesterday, and you've mentioned before, it stems from houselessness, but we heard from Station 20 West, it's not houselessness. It's not just, a Pleasant Hill problem. This isn't a houselessness problem. This is affecting everyone in the city. There are university students accessing these drugs. So what is the city doing to protect all of its citizens in this?
Well, fire and police are obviously on the front lines, and we have our own emergency measures organization that is helping to coordinate. In terms of what we're up against, I will still say that the overdose crisis is a symbol of a larger crisis with regards to homelessness, and that is a larger crisis against a lack of housing, and the housing crisis is a lack of affordability. And all of those pieces are connected, and unless or until we get to the other side of this, I don't think we're going to see significant change in our community. So for all of the other reasons that we are, otherwise seeing mental health and addiction and trauma, that doesn't mean people can't be safely housed. And on that university student, Mark, I talked to so many students during the election campaign last fall, some of them sleeping 9 to a 2-bedroom apartment. And I think that speaks again to the wider crisis that we're facing around housing and affordability. And just a reminder to folks that City Council over the past 6 months has approved 756 new affordable housing units. It's going to take time for those to come on stream. And we're working urgently with the province and others to figure out where those gaps can be filled in the meantime. But I am encouraged that we are going to get to the other side based on the processes and the approvals in place so far.
I mean, recently we've seen 2 library branches temporarily close because of this crisis. Was too hard to handle for staff, on top of other issues as well when it comes to violence and how staff is being treated. So what can the city do to ensure, those branches are safe for staff and for the public to go to when hopefully they reopen?
Well, my understanding is that the library has its own board and its own legislation, as you know. But my understanding is that they are taking this time to make sure that they are creating an overall security plan. I can't speak for the library, but I know that many people who want to access the library have had concerns, especially downtown. And how can we make sure that the library is open and accessible to all who wish to use it? Because that's what it's there for. But also make sure that we are keeping everyone safe who wants to access those facilities. And my understanding is that's the work that the library is working on right now.
I know that's the inside workings of the library, but a lot of this stuff is happening outside of the library, which is, city property. So is there going to be more patrols down there? More, there are drug deals happening right in front of the library, in front of people in open, broad daylight.
Yeah, so a couple of things on that, and I would have to probably let police speak more specifically to those plans, but we do know that adding more patrols into the downtown are very much part of the strategic plan of Saskatoon Police. And I believe that the legislation that is before the legislature right now that hasn't been passed yet, but was announced last fall with regards to safe neighborhoods, and was, I guess the legislation was. There was an addition added in the spring, or maybe it was a couple months ago now. You know what? It's been in the last few weeks where whether it's bear spray, knives, or fentanyl or meth, that there would be an opportunity when somebody is observed having this illegal weapon or drug, that police would be able to apprehend and search. I think that will be a help. And I think that, the reason that I'm encouraged by, what this legislation could mean is I do think it can support the safety on the streets, but it's not targeting users. It's not targeting people who are unwell and need help. It's targeting the dealers and the folks that are creating this very lethal drugs on our street.
Well, Prairie Harm Reduction does work to help those who are using and who are struggling. They've closed as well to give their staff a much-needed break. They have asked the province for help. They have not heard a response yet. That is a physical place in our city that is helping people. So can the city step up to help Prairie Harm or push the province for more assistance when it comes to harm reduction?
I mean, I can't speak for the province. I can say that the province has been willing and stepping up to otherwise sort of support the request that the city is asking. That we know that we need more people in the streets to deal with the overdose crisis. We need paramedics and we need fire paramedics. And between Medivy and our firefighters and the additional resources that the province announced yesterday, is that enough? I mean, I can't answer that, but I know that our folks in our emergency measures organization and fire and police will be letting us know if they need more.
But I mean, Prairie Harm Reduction tests these drugs to find out what exactly is in them. They're able to do that to have that safe consumption site. So wouldn't you want to press the government to help them when they need help and they're asking, they're closing, their staff is struggling, and they're just trying to help people, which it seems like you want to do as well. So can't you push the province for that assistance?
I think that, we miss Prairie Harm and we know the important work that they do in our city. I can't speak for the province, but I can tell you that we will continue to urge them to do all they can to ensure that we have the resources we need to save lives, to get to the other side of this overdose crisis, and, quite frankly, along the continuum of crises, to get to the other side of homelessness.
All right, Cynthia, we had a lot to talk about today. I know there's a lot going to council today as well, so hopefully we'll be able to follow up on that later this week on the show. But we do appreciate you coming in and kind of breaking down exactly where our city is at and the plans to move forward.
Thanks for having me.